BS. If you have knee pain, what are the best treatments available to you? We're going to talk about some home remedies, medical treatments, as well as advanced treatments, including surgery. And at the end of this video, I'm going to tell you exactly who should get an X-ray, an MRI scan, and most importantly, when you should see a surgeon. So stay tuned. I am a board-certified and fellowship-trained orthopedic surgeon, specializing in the treatment of the foot and ankle. Let's start with No. 1, which is rest. When you have pain in your knee, you may be tempted to keep it moving and keep it active. 2. However, in the early stages, when there's a lot of pain and swelling, sometimes the best thing you can do is to simply rest your leg and avoid putting any extra pressure through that knee. That means avoiding certain activities that put more stress on your knee. It could mean taking a break from running or other high-impact sports. You want to avoid activities that cause more pain. Sometimes even simple things like going up and down stairs can be difficult if you have pain. And so make sure that you take it easy and give the knee time to heal. The next home remedy is ice or heat therapy. 2. Early on, you'll notice that your knee may be swollen, and ice is great at reducing swelling. Applying ice directly to the area can actually constrict those blood vessels that are bringing more blood and more inflammatory cells to the area. Once that swelling goes away, then you can apply heat to the area. Heat increases circulation and it's really good at helping with stiffness. There are special bags that you can fill with either frozen peas or warm water that you can apply directly to your knee. 2. If you don't have access to something like that, you can use an ice pack out of the freezer or a heating pad from the bathroom. Another home remedy is exercise and stretching. And it may sound counterintuitive, since we just talked about resting your knee and taking it easy. But gentle exercise actually helps get blood flow to the area and can help reduce pain. Gentle walking is usually a great place to start. Any type of motion is usually better than no motion. Of course, if there's a certain range of motion that causes pain, you want to avoid that. But typically walking is great. Swimming is a wonderful, non-weight-bearing, low-impact exercise that gets the body moving and helps improve range of motion. Cycling is another great option because it keeps the knee moving, but again without putting a lot of stress through it. The muscles around the knee, especially the quadriceps muscles, actually help stabilize the knee. And so strengthening those muscles is very important for long-term recovery. So now, let's talk about some medical treatments. What can a doctor do for you if you have knee pain? Now, these are not all treatments that you need to try and order. These are all options that may be available to you. No. 1 is painkillers or anti-inflammatory drugs. Your doctor may prescribe certain medications, such as ibuprofen, naproxen, or other anti-inflammatory drugs called NSAIDs. These are great at reducing pain and swelling. If your pain is mostly due to inflammation, these will really help. The downside to these medications is that they can cause side effects such as stomach pain, nausea, and they can actually increase your risk of bleeding. Your doctor may prescribe stronger painkillers such as opiates or narcotics. These are generally not recommended for long-term use. Since they can lead to dependency, your doctor may recommend certain supplements such as calcium, vitamin D, or glucosamine and chondroitin. These are considered safe for most people, and they worth trying if you feel that they helping. However, they are not a substitute for a healthy diet. And always check with your doctor before taking any new supplements. Next is physiotherapy. A physical therapist is a doctor of physiotherapy who is specially trained in helping you recover from injuries and surgeries. They're experts at helping you regain strength, improve your balance and coordination, and improving your overall mobility. They'll look at how you walk, they'll observe your movements, and they'll develop a plan to strengthen the muscles around your knee. For example, they'll have you perform heel raises on your toes while standing. This helps strengthen your calf muscles. This actually helps indirectly strengthen your knee. Certain machines like the hamstring curls strengthen the back of your thigh muscles, which are important stabilizers of the knee. There are a ton of different exercises that physical therapists use to treat patients with knee pain. In addition to physical therapy, your doctor may recommend injections into the knee joint. These could be steroid injections, which are also known as corticosteroid injections. These reduce inflammation. So if your pain is mostly due to inflammation, then these can be a great option for you. However, they're not meant to be a long-term solution. Since they can have some negative effects, they can thin the cartilage over time, and they can be painful to get injected. That being said, if you have severe knee pain, then it's definitely an option worth discussing with your doctor. Another type of injection is hyaluronic acid injections. These are also known as viscous supplementation. So rather than reducing inflammation, these injections add lubrication to the knee joint. And so if your pain is due to osteoarthritis, this can be a great option for you. These injections are usually made from a compound called hyaluronic acid. This is the same compound that your body naturally produces, TOBA. Over time, the natural levels of hyaluronic acid in your knee joint can wear down and become depleted. And this can lead to more friction within the joint, which leads to more pain. And so replacing it has been shown to be effective at treating osteoarthritis-related knee pain. Let's move on to some advanced treatments, including surgery. If you've tried conservative treatments, such as medications, injections, physical therapy, and you haven't had much luck, you may be a candidate for arthroscopy. Arthroscopy is minimally invasive surgery, where small incisions are made around the knee. The camera is inserted into the knee joint and the surgeon can then look inside the joint. Through the camera, small instruments can be inserted as well, and the surgeon can repair torn ligaments or remove damaged cartilage. Now, arthroscopy is not indicated for everyone with knee pain. For example, if your pain is due to arthritis, then arthroscopy won't help, and it can actually make arthritis worse. And so if you're suffering from knee pain due to arthritis, then your best option may be a partial or total knee replacement. A total knee replacement is a procedure where the damaged bone ends and cartilage are removed and replaced with metal and plastic components. Now, this is major surgery, and it's reserved for people whose pain is uncontrolled with less invasive options. Finally, if your knee pain is due to a torn ligament such as the ACL or the MCL, then you may need a procedure to repair those ligaments. If you've heard a pop in your knee and then your knee buckles or gives way, chances are you've torn your ACL. And if you've recently injured your knee and have pain on the inside of your knee and swelling on the inside of your knee, chances are you may have torn your MCL. Both of these are very common knee injuries that require surgical repair. Now, this is a very general list of treatments. It is very important to understand that the right treatment for you depends on why you have knee pain. If your pain is due to arthritis, then the treatments are different than if you have pain due to an injury or a ligament tear. There are so many different causes of knee pain, and so, seeing an expert, an orthopedic specialist, is extremely important to make sure that you get the right diagnosis and the right treatment. So who needs an X-ray, an MRI scan? Well, everybody should get an X-ray if they have knee pain. An X-ray is a good starting point to look for any alignment issues, any signs of arthritis, any signs of a fracture. If your X-ray is normal and you still have pain, then an MRI may be helpful. An MRI is great at looking at the soft tissues of the knee, including the cartilage, the meniscus, the ligaments, the tendons. If you've had a recent injury, then an MRI is usually very helpful. If your pain is chronic and you've had pain for months or years, then an MRI may not be as helpful. In that case, your doctor may want to do an arthroscopy to look inside the joint and determine the source of your pain. Now, if you'd like me to make a separate video on specific knee exercises that you can do at home that usually help reduce knee pain, please let me know in the comments below. As always, I hope you enjoyed this video. If you did, please give it a thumbs up. If you're interested in learning more about the foot and ankle, please subscribe to my channel. Thanks for watching. I'll see you next time.